The High Country Behavioral Health Building here was a partnership between the City of Evanston and High Country Behavioral Health. It was a public-private partnership that was unique to its time. High Country put a significant portion, $1 million, I believe, into this building, along with the medical Spec building under readiness that we did to help finish off this building.
I think the perspective that we had in participating with the state and the city in developing this building was to have a wide range of services available within the building, kind of a one-stop shop facility.
I think it was a great partnership, and City of Evanston turned out as the applicant community, and they looked forward to what could work in Evanston.
What we have here primarily is an outpatient mental health clinic. People coming in on a weekly basis, meeting with somebody and getting mental health services. That includes having availability of psychiatric care so that they can receive their medications here also. We have over 700 client contacts in a month. As part of that outpatient services, we have group rooms where we provide group therapy. We also have a play therapy room, which is designed specifically for children to give them an opportunity to use toys as a way to interact with the therapist and also as a way to express the difficulties that they're struggling with. A play therapy room is different than a typical therapy room logistically. The room has a tile floor because kids will use sand or other paints or other kinds of materials. They can play, they can drop things, and it's easy to clean up. We also have a day treatment area of the facility in which people with long-term mental illnesses can come in and they can get therapy. They can participate in group therapy, but also they can have available to them an opportunity to have skills training, such as learning how to cook, learning how to budget finances, social interactions. They also can develop hobbies, recreational skills, very much like a home setting. They learn housekeeping, house cleaning. So it's a setting where they can learn daily living skills that go across a wide range of areas of their life. Previous to this, we were spread throughout the city here. Our outpatient offices were at one location. The emergency detention, the crisis services were at another location. And those chronically mentally ill folks were at a third location. And here we've been able to bring it all together so that, for example, with a chronically mentally ill, when they come in for the day treatment, if there's a particular crisis or concern that they need to have addressed, then we can just simply walk them down the hallway and there's their primary therapist. There's also who can work with them. We have a case manager that will also work with them. And so there's some real ease with that. Also, another, I think, an important part of the building is that we have the capability of bringing in a medical provider, be that a physician or be that a nurse practitioner. There's a real need in a primary care setting to have an integrated approach for primary care and mental health services.
I know we set up this building as a Spec building, and we were looking at bringing in another type of complementary medical that is a skilled position and highly needed.
And it's a great benefit to them to provide that integrated care at one location. This is a movement that has been seen in the United States for a number of years. I think here in Uintah County we're responding to that. Finally, we have our emergency detention rooms, which are serving a tremendous need here in our community, because in the past we've not had a dedicated facility set aside for folks who need emergent mental health services, folks who need a more restrictive setting, who need supervision, they need care, they need a setting and where they're going to feel safe while they are awaiting disposition either back to the community or to an inpatient facility. These are folks who are imminently dangerous, such as suicidal to themselves or to others, and who need to be further assessed to see, indeed, do they need to be receiving more intensive care in an inpatient hospital. We've not had that facility here in Uintah County before. Now they, instead of just sitting, for example, at the jail or sitting in a room at the hospital. Now they will be getting care, mental health care, during the time that they're on emergency detention, because we'll have the therapists available, we'll have the case manager available, and so we'll be able to take advantage of that 72-hour period where they'll be getting care. And I think that raises the likelihood that they will be then discharged or go back to the community, and we'll be able to avoid them going into the court system and having to go to court and meeting with the judge, and the judge making decisions and directing them to care. We'll be able, I think, to intervene there so that it'll take the pressure also off the court system. So it's a real integrated building that provides services across a range, and I think will reduce actually the involvement with a lot of other organizations or services in the community.
As we were walking around the building, I see your servers in the back. We are looking at extending some fiber throughout Evanston and doing in southwest Wyoming too. When I see that server back there, I know how important that fiber must be to transmit medical records, and how important it is for Evanston, especially with the state hospital and all the ancillary businesses that complement that state hospital and the services it provides.
One of the benefits I think we have also gained from this is we look into the future, planning for the future. We have additional property to the east of this building of sufficient size for us to build a group home and to build also supervised apartments for the chronically mentally ill population. That's been of importance to us as we are projecting into the future.
A beautiful building, and I think this will make it a long-term public-private partnership that I think the Business Council can be very proud of.